Welcome to another episode of Clot Conversations from Thrombosis Canada. I'm David Airdrie, Executive Director, and I'm here with a special guest host, Dr. Gregoire who will be interviewing Dr. Vicky Mai. We're here to provide you with updates on diagnosis and management of thrombosis, featuring interviews with authors of recent research publications and highlights of education programs from Thrombosis Canada. Today's episode is our second from the ISTH 2023 meeting in Montreal. Thank you for joining us for this episode, and we'll have our guests introduce themselves.
Oh, hi, I'm Gregoire. I'm one of the thrombosis doctors in Ottawa and reporting live from ISTH meeting, and here today with Vicky Mai. So Vicky, was it your first ISTH meeting?
No, it was my second in-person meeting. I attended the one in London last year.
Very good, but you had a lot of success this year. So can you tell us about a bit of what you've been presenting on this year?
So I started, the first study I presented was a systematic review with meta-analysis on thrombolysis in intermediate high and high-risk PE. The second one was an abstract on a sub-analysis of the PREDICTORS study, which looked at the risk of recurrent VT in patients who presented with a suspicion of recurrent VT on anticagulation. And there's two projects on COPD exacerbation and pulmonary embolism.
Very good. So which one was most challenging to present, or what were you most worried about when presenting?
Oh, it's a really good question. They all have each of them their challenges. I think one of them that was really interesting is the one on systemic thrombolysis in a patient with high-risk mortality with an acute PE, since including 155 studies with almost 100,000 patients, we're still not able to show that there was a treatment that was better than the other, showing that further studies are needed in this field, especially if we need more comprehensive studies and probably more collaboration to help and try and have a definitive answer for this question on this topic that would probably help improve patients' outcomes.
Very good. And then on the predictor study, you were saying diagnosis of recurrent PE on anticoagulant, right? So that was kind of new. I don't think there was much published on that before.
Exactly, that there's not much data on patients who on the D-dimer levels and patient on long-term anticoagulation presenting with a suspicion of recurrent VTE. And we did show that the overall recurrence was 2.6% with a 95% confidence interval as high as 9%. So, which is quite high. So I think we still need some further studies on this topic before integrating D-dimers in this population.
Very good. And did you get good feedback, or did the message go through, or do you think people what the take-home message was received by the audience, or?
Oh, I hope that it was well received and that people will remember that message, because it's the main result of our sub-analysis of the PREDICTORS study. And I hope that my message was clear enough. If not, I think I just repeated here in the podcast.
Very good, very good. Good opportunity. All right, so let's move on to maybe COPDs, and so to the two projects, quite different one from another, right?
So the first one, we looked at standard diagnostic algorithms and also CTPA-sparing diagnostic strategies in patients with COPD with an acutely worsening respiratory symptoms to see how they performed. And we're able to see that standard diagnostic algorithms were safe, but a high number of patients would need a CTPA, whereas CTPA-sparing diagnostic strategies were able to reduce the need of imaging by up to 32%. However, the diagnostic failure rate of VT was higher than the safety threshold. So once again, further studies needed in this area.
Okay, very good. And what do you think, like, benefits of presenting here? Like, was it about getting the feedback from the people, or other aspects related to the meetings, the networking? What did you enjoy most?
I enjoyed a lot of things. I think it was really good to have feedbacks from everyone after each presentation, but also networking, meet people who are so interested in research in thrombosis. It's really something I enjoy.
Very good. Thank you, Vicky.
Thank you both for joining us for this episode of Clot Conversations. Thank you for listening to Clot Conversations from Thrombosis Canada. We welcome your comments, questions, and suggestions on the podcast. If you have any recommendations for future podcasts, please send them to us at info@thrombosis.canada.ca. And please subscribe so that you are notified about the release of new episodes. And don't forget to check out our newly updated website for education programs, clinical tools, and guides. Also, please consider donating to Thrombosis Canada to support our ongoing efforts to reduce morbidity and mortality due to thrombosis. Thanks again from ISTH in Montreal.